Why is your dog obsessed with rocks? Or why do you see your cat chewing on cords? I'm Dr. M. Welcome to VMC. Today we're diving into the world of pica, and we are going to cover the common potential issues that might be causing it, as we have some new research in this area. Join me, you'll learn something today. Before we go into anything else, let's first define what pica is. Commonly in the vet clinic, I will have clients tell me about some strange eating habits that they note their animals have. Most commonly, I will hear about things like rocks, cloth or other fabrics, soil, metallic items, electrical cords, hair ties, sometimes plastic or pieces of rubber, and there may be other things that you've had an animal persistently want to eat before. So this problem is called pica, and the definition of this is when the animal is consuming a non-food item that doesn't benefit them in any way. Now, it's important to note that there will be more animals who will be chewing on these sorts of items, and it is a smaller subset who will deliberately be swallowing them. Some might swallow them a bit accidentally. And so why does this even matter in the first place? Who cares? Let them chew on whatever they want, right? No, please don't. There are many of these items that can cause significant damage to your dog and your cat's mouths. It could be wear to the enamel, and commonly we will see fractures of especially the fourth premolar in our dogs and our cats from chewing on items that are too hard or just not appropriate for them. Now, of course, if they end up swallowing a piece of these sorts of items, this can cause a whole other host of problems. If it's sharp or pointy or jagged, we could have damage to the esophagus, the stomach, the small intestines, or even the colon. Sometimes items will get stuck in the stomach, and then you might have a pet who's not eating very much. They might lose weight, they might be vomiting intermittently. Other times, items might pass through the stomach but then get stuck in the intestines somewhere. When this happens, this is quickly life-threatening. And there was one research study that found around 10% of animals who present for an intestinal blockage will end up dying due to complications of this blockage. One thing I do want to make sure we remember is that it's also possible for these animals to have trichobezoars, aka hairballs. We most commonly find these in cats, but dogs can occasionally have them as well. Next, we should dive into the common reasons that our animals might be showing us this pica behavior. Sometimes if animals are weaned when they are too young, most often I'll note this behavior in cats, they will take the nursing, suckling behavior and transfer it on to other items, often fabric, but sometimes people or the hair of the people or clothing or skin of their people. When puppies and kittens go through the teething process, they are more likely to want to chew on things in order to try to soothe and massage their gums. If we aren't providing them with enough appropriate items that they can safely chew on, then they will go and they will find something to chew on in order to try get themselves some relief. And occasionally these animals might develop a continued preference for a specific object because of this. The next category are animals that have a nutritional deficiency. For example, there are some animals who will try to ingest soil if they have a mineral deficiency. Sometimes if animals have an anemia, this can result in them displaying pica behaviors as well. Perhaps the most common medical issue that I will see resulting in my patients displaying pica is if they have experienced a chronic GI issue of some sort. So we call this a chronic enteropathy. That means if for over 3 weeks in duration they have been experiencing some kind of GI upset. This might involve symptoms like diarrhea, vomiting, maybe a change in appetite. In more severe cases, we might even see weight loss. Now, the pathophysiology of chronic enteritis isn't fully understood in veterinary medicine. At this point, we think that there is a lot of interlapping, complex interactions between the environment, the genetics of the animal themselves, the intestinal environment, and even more specifically, the gut microbiome or the good bacteria that's living there. And then, of course, the immune system plays a role as well. So the recent research that I briefly alluded to earlier was published in the AVMA. And in this study, they looked at animals who had presented and ended up having an endoscopic removal of a foreign body. That means a small camera went down the throat and was grabbing items out of the stomach of these patients. 66% of the over 100 patients had chronic enteropathy symptoms, and there were 41 animals who ended up having biopsies done at the same time as the removal of the foreign body. 100% of the animals that were biopsied had chronic enteritis, meaning longer-term inflammation showing in those samples that were taken out of the stomach and small intestines. It's also important to note here, just as a little side note, that about half of the animals who were biopsied ended up having evidence of Helicobacter, which is a type of bacteria that can take residence in the GI tract of some animals. Animals that had this spirochete bacteria we call Helicobacter ended up having worse clinical symptoms than those who didn't. Now, specifically for more of our feline patients, trichobezoars or hairballs are thought to form as foreign bodies in the GI tract secondary to another medical issue. Most often, this will be chronic issues with the GI tract that's causing inflammation and a change in the motility that the GI tract is experiencing. In a healthy cat, when they groom, as we all know they spend a fair amount of time doing, they're often very meticulous creatures. But when they groom, it is normal that they will end up swallowing some hair. When the GI tract is healthy, that hair just moves through with other ingesta. They end up defecating it out. No harm, no foul. But if the GI tract is experiencing a problem, then the peristalsis that moves food and other things through the GI tract could be slower or altered in a way that the hair gets stuck and it builds up instead. We also need to remember that grooming more than is usual can be a symptom of pain in cats, along with itching. But for this specific video, we are mostly considering pain related to GI problems. So if they're trying to soothe themselves from something like abdominal cramping or other pain in their bellies, then they might be grooming more than normal, and this will also predispose them to forming hairballs in their GI tract. The last subsection of common causes for pica involve behavior to different degrees. Most commonly under this subsection, I will see animals that are not being given appropriate enrichment and or activity by their people. When we are not providing our animals with appropriate exercise, brain stimulation, social interaction, playtime, time with their people, and so on, then we will often have animals that will go and create their own fun. For example, if we aren't giving our animals appropriate chew items or not rotating them out enough to keep your animal invested in them, then they might go and they might start chewing on wood that they find or something in your house, or they might grab rocks outside, that sort of a thing. It's also possible that dogs and cats might start doing the pica behavior if they are feeling stressed or anxious. For dogs, I will often see this related to separation anxiety. Cats have also been reported as starting pica after a new animal has joined their household. That's because this is often a very stressful event for them. I do have a previous video on how to introduce a new animal to a cat in your household. I'll make sure it's linked in the video description for you. And lastly, there will be some animals who have a true compulsive disorder. Oriental cats like the Siamese and the Burmese have a genetic predisposition to this, and often if this pica is showing up in those cats, it often presents as wanting to suck or chew or eat wool or other fabrics. For dogs that have a compulsive disorder, that can show up in a number of different ways, and one of those ways is this behavior of pica that we're noting. There may be a genetic link to compulsive disorders, and it will be important if your animal ends up going through the medical workup and addressing enrichment and all those other things, and you're still having trouble, then you will need to be working with a veterinary behaviorist to help your animal. The way to best summarize treatment for pica is to figure out and then treat the underlying cause of it. So depending on the age of the animal, we might need to be working a lot harder on providing items to chew on to soothe teething issues, or to try to redirect animals to a safer item to chew or suckle on if they've been weaned too early. Addressing enrichment and activity is also going to be key. I have previous videos, one for dogs and one for cats, covering the basics of enrichment that you will need to know about. I'll link those in the video description as well. Next, it is absolutely key to ensure that you are feeding a properly formulated research-based diet that meets WSAVA guidelines. This will help to ensure your animals don't develop any deficiencies or any other nutritional causes that predispose them to pica. If you've done all of those things already, the next thing to do is to see your veterinarian for an appropriate medical workup. This generally involves things like blood work to check for anemia and other common medical issues that way. We may also need to run a GI specific blood work panel to check for some other common GI diseases. Sometimes we will be recommending a prescription hypoallergenic formula so that we can do a proper food trial, and it's possible that an abdominal ultrasound may also be necessary. Depending on what the results are for all of those tests and interventions, once we know what the underlying medical issue is that is impacting the GI tract, then we can formulate a specific medical treatment plan for it. In the meantime, while we're working to figure out the exact problem, we should be using medications to help treat nausea or to help with abdominal pain, or to treat diarrhea or whatever the symptoms are that your animal has that's correlated with their upset GI tract. If we end up finding that there's inflammation in the small intestines, some of these animals do end up needing medication to help to reduce that. More recent research is showing us that a lot of times budesonide is very successful in doing this, but there are other medications we use as well. Cyclosporin and prednisone are common options as well. And if your dog or cat has gone through all of those things and has had an appropriate medical workup, then you may end up needing a referral to see a veterinary behaviorist as well. They can help with figuring out if there might be any anxiety or stress that is contributing to your animal's pica. So to determine the underlying cause, it will be important to track how often, how long, and when your animal does this pica. And in many cases, the behavior may also occur when you are not present, so we will often need to video our animals when we are away. The veterinary behaviorist can then help you with appropriate management plans, appropriate behavior modification plans, and they can also help with appropriate prescription medications where necessary. If you have any questions about pica, or you have a topic you'd like me to cover in a future video, please comment it down below. We do put up a new video most Fridays, and YouTube thinks you'll like this video. I can't wait to see you next week. Bye for now.